Chronic cough. Overview. A chronic cough is a cough that lasts 8 weeks or longer in adults or 4 weeks in children. A chronic cough is more than just an annoyance. A chronic cough can interrupt your sleep and leave you feeling exhausted. Severe cases of chronic cough can cause vomiting, lightheadedness, and even rib fractures. Where it can sometimes be difficult to pinpoint the problem that's triggering a chronic cough. The most common causes are tobacco use, postnasal drip, asthma, and acid reflux. Fortunately, chronic cough typically disappears once the underlying problem is treated. Symptoms. A chronic cough can occur with other signs and symptoms, which may include a runny or stuffy nose, a feeling of liquid running down the back of your throat, post nasal drip, frequent throat clearing and sore throat, hoarseness, hoarseness, wheezing and shortness of breath, heartburn or a sour taste in your mouth, in rare cases, coughing up blood. When to see a doctor? See your doctor if you have a cough that lingers for weeks, especially one that brings up sputum or blood, disturbs your sleep, or affects school or work. Causes. An occasional cough is normal. It helps clear irritants and secretions from your lungs and prevents infection. However, a cough that persists for weeks is usually the result of a medical problem. In many cases, more than one cause is involved. The following causes, alone or in combination, are responsible for the majority of cases of chronic cough. Postnasal drip. When your nose or sinuses produce extra mucus, it can drip down the back of your throat and trigger your cough reflex. This condition is also called upper airway through syndrome, UACS. Asthma. An asthma related cough may come and go with the seasons, appear after an upper respiratory tract infection, or become worse when you are exposed to cold air or certain chemicals or fragrances. In one type of asthma, variant asthma, a cough is the main symptom.